Assalamu alaikum, I am Dr. Iram. Today we are going to discuss about the brachial plexus. As in the previous video discussed that the plexus is the network of nerves. There are 4 plexuses in our body: brachial, cervical, lumbar and sacral. Today we are going to discuss in detail about the brachial plexus. Brachial plexus is actually formed by the anterior rami of C5, 6, 7, 8 and T1 roots. C5 and 6, these roots combine to form the trunks. Then they divide into the anterior and posterior divisions. Then these combine to form the cords, lateral, posterior and medial cord. Lateral cord divides into 3 branches, posterior cord into 5 branches and medial cord into the 5 branches. C5 and C6 nerve roots combine to form the upper trunk. C5 and 6, as you see, combine to form the upper trunk. C5 give another root nerve, that is dorsal scapular nerve, supply the levator scapula and embody major and minor. Middle trunk is the continuation of the C7 nerve root, and the lower trunk formed by the C8 and T1. The long thoracic nerve originate from C5, 6, 7 that supply the stratus anterior muscle, and its injury caused the winging of scapula and Hornburn syndrome. One nerve originate from the upper trunk, that is subscapular nerve. Upper trunk give a suprascapular nerve that supplies the supraspinatus muscle and infraspinatus muscle. There is no nerve originate from the middle trunk and the lower trunk. Then these trunks divide into anterior posterior divisions, and no nerve originate from these divisions. Then the cords formed by the combination of these divisions. All 3 posterior divisions combine to form the posterior cord. The anterior division of upper and middle trunk form the lateral cord, and the medial cord is the continuation of the anterior division of lower trunk. 3 branches originate from the lateral cord. These are the musculocutaneous nerve, lateral branch of pectoral nerve and lateral branch of medial nerve. 5 branches originate from the posterior cord. These can be remembered by mnemonic stars: STARS. S mean subscapular nerve, upper subscapular nerve. T mean thoracodorsal nerve. A mean axillary nerve. R mean radial nerve. S mean lower subscapular nerve. Upper subscapular nerve supply the suprascapular muscle. Lower subscapular nerve. Lower subscapular nerve supply the dorsal nerve supply the latissimus dorsi. Axillary supply the deltoid and teres minor. Radial supply all the muscles posterior arm and forearm. Medial cord give 5 branches: medial cutaneous branch of arm, medial cutaneous branch of forearm, radial, ulnar, and medial branch of median nerve. We can also show this brachial plexus by a tree, as the tree has roots, trunk, divisions, cords and branches. Roots are C5, 6, 7, 8, T1. Then they form the trunk, upper, middle and lower. Then they divide into anterior posterior divisions. Then these combine to form the lateral, posterior and medial cord, and these divided into branches. Cords are in relation to axillary artery, as the lateral cord is lateral to axillary artery, medial cord is medial to axillary artery, and posterior cord is posterior to axillary artery. Thoracodorsal nerve used frequently as a free tissue transfer. Now you can see the whole brachial plexus we can draw like this. Thank you.